Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on resolutions up for debate when the UCP gathers for its AGM. But first, the loss of Canada's measles-free status.
Once the outbreak's declared over, then we will have to work for 12 months to sustain that lack of transmission. And at the end of that 12 months, we have to prove to the Pan American Health Organization that we have no transmission.
Declining vaccination rates and sporadic outbreaks have resulted in Canada being stripped of its measles-free designation by a branch of the World Health Organization, a status held since 1998. There have been more than 5,000 cases across much of the nation, nearly 2,000 of which have been reported in Alberta since outbreaks here began in March. Joining us now, Dr. James Talbot, a public health physician and former Chief Medical Officer of Health in Alberta. Dr. Talbot, good to see you, sir. Welcome back.
Thank you for having me. Good to see you, Michael.
All right. Well, what does this lost designation represent to you as a health professional?
Well, two things. One is that it's an admission to the world that we have failed to control a very important communicable disease, and that the world needs to take precautions, either for their own citizens traveling to Canada or for Canadians traveling to other countries. And the second thing it means to me is that we need to address the root causes of how we lost that control so that we can regain that status in the future.
As we saw in the graphic a moment ago, Alberta second only to Ontario in the overall case count. What is to be made of our province's role in this outcome?
Well, we've been the major contributor if you take a look at the per capita number of cases. So we're responsible for about 40% of the cases in Canada, with 2,000 cases in Alberta, most of them in children, obviously. And we only have 10% of the population. So we have more cases in Alberta than the US has in total. And we have the worst rate in North America of any jurisdiction. So all of those numbers, and I think one that might be of interest to viewers is that because measles was eradicated, the cases that we have this year are actually worse than the last 30 years in Alberta in total. So that's how bad our performance has been.
On the performance side, the province says more than 137,000 vaccines have been administered since March, a 50% increase year over year. How would you rate Alberta's progress in bringing the outbreak under control?
Well, it's been nowhere near enough. That's why it's taken so long and why our performance has been so bad compared to other places. They always talk about how many they've given, but they haven't talked about how close they are to achieving important numbers like 90% of kids under the age of 5 being immunized. 137,000 on a population of 5 million when North, Central, and South are at about 50% of the immunization rate and way away from the 90% that we would aim for. It's just a measure of, it's a drop in the bucket compared to what we need to regain that status. It's a bit like if you had a losing hockey team and, the score was telling you that you were losing, but the coach was telling you, well, we're getting more shots on goal. Fine. I'm glad that you're getting more shots on goal, but we're clearly still losing.
What does that say to you then about the state of public health in Alberta?
I think there are two things that it says to me. One is that we need the courage and the leadership from the provincial government to commit to, let's say, a 5-year plan to get immunization rates for the kids under the age of 5 back to 90%. So we need that kind of commitment, and we need then the resources, and we need the government to commit to reporting on the yearly progress to getting to the point where our kids are safe again. And the second thing that it tells me is that there hasn't been enough attention paid to how badly the public health system has been damaged by things like COVID and the constant restructuring and political interference that's going on. I know a lot of people in public health who got burnt out or had to leave the system because COVID was such a stressor. They were on the front lines before there was a vaccine, and then after the vaccine, it was a sprint to try to get people as protected as possible. And there's been no recognition by this government that we need to strengthen those systems, particularly if we're going to regain that measles-free status. So two things: one, a commitment to get the immunization rates up, and two, the resources to be able to do that and to rapidly bring any new outbreaks under control.
Maybe to follow up on that, Dr. Brian Worsba, the new president of the Alberta Medical Association, identifies vaccine hesitancy as one of the challenges here. What is the risk of a resurgence of other problem diseases beyond measles, given current dynamics?
It's pretty significant. If you take a look, first of all, measles comes as a package with mumps and rubella. And then there are other childhood immunizations that are very important, like diphtheria, pertussis, tetanus, and polio. A lot of people think that because the rates have been low for so long, as they were for measles, that these diseases have gone away. They haven't. The bacteria and viruses are still circulating, in some cases within Canada, in some cases within the world. And so because of that, we're always at risk of these things coming back and killing kids or maiming kids or permanently damaging their hearing or their mental acuity. Diseases like diphtheria, where you can end up with paralysis of the breathing muscles and kids suffocating, or whooping cough, where kids sustain brain damage because they're not getting enough oxygen because they're coughing so hard, or polio, for those of us who remember it or have family members who are affected by it, which can cause people to be on ventilators lifelong or be crippled because of the effects of the virus. These are not things that we want to wait until people understand the urgency, because they've seen cases happen. And all of the rates for immunization for those diseases are way below where they should be in Alberta. There are parts of Alberta where the immunization rates are actually below what we'd see in the third world.
All right. We'll have to leave it there for time. As always, appreciate your time, Dr. Talbot. Thank you, sir.
My pleasure. Thank you.
Dr. James Talbot, a public health physician, former Chief Medical Officer of Health in Alberta.